Mental health is defined as an emotional and social well-being and having the psychological resources to deal with the day-to-day demands of life. However, mental disorders are defined as health conditions characterized by alterations in thinking, mood, or behavior associated with distress and impaired functioning, while mental illness is all diagnosable mental disorders. Some factors that lead to mental disorders are physiological factors, social characteristics, and chronic stress. 42.5 million US adults are affected by some form of mental illness yearly, which is around 18.2% of the adult population. Ethnically, mental illness has higher rates in Pacific Islanders, American Indians, and Alaskan Natives. A growing population of inmates also suffer from mental illness. Greater than 50% of inmates suffer from mental illness, and a recent study showed that inmates suffering from mental illness are more likely to be at risk of becoming a repeat offender.
Over the past several decades, we have seen significant improvement in mental health care. Beginning in the mid-20th century, the deinstitutionalization of state mental hospitals allowed for more proper support and treatment of mental illnesses. Later on, the establishment of government-sponsored community support programs was a huge step forward, as it provided people with chronic mental illnesses with the resources to successfully live independently. These communities have become more widespread and have developed many effective inpatient care and appropriate services to help their patients. In regards to treatment, there are three main methods to treat mental illnesses. This includes psychopharmacological therapy, psychotherapy, and psychiatric rehabilitation. Federal programs play a large role in providing access to mental health care. Programs such as Medicaid pay for more than half of public mental health care. Although we have seen incredible improvements and advancements in regards to intervention and treatment of mental illnesses, these resources are not easily accessible to everyone, and many people still deal with the stigma of mental illnesses, which prevents them from receiving the appropriate care.
There are many places that provide information about mental illnesses. You can go to a local mental health organization or access a local state or federal website. If you or someone you know is in a crisis, there are multiple hotlines available that have trained professionals available to talk 24/7. If you are not in a crisis, one of the best ways to seek care is by getting a referral from your primary doctor. They will be able to get you in touch with a specialized therapist that best fits your needs. You can also find affordable mental health services through the Substance Abuse and Mental Health Services Administration. The most common misconception about mental illness is that it's fake. Another prominent misconception is that people with a mental illness will never get better. However, treatment actually works. The problem is the delay in receiving treatment. The average delay in receiving treatment is 10 years after the onset of symptoms. There was a study conducted that found delays in seeking general medical care are common and linked with common medical conditions. The results may help to explain elevated morbidity and mortality associated with serious mental illness.